My name is Agnes Zsigovics, and I work for the Leukemia Lymphoma Society, and my role there is to oversee patient services, as well as provide education programs for both patients, caregivers as well, and healthcare providers. We also do some legislative advocacy locally, which is also very important. I'm here today for two reasons: to introduce you to the Leukemia Lymphoma Society. We're just going to put up the mission statement and talk a tiny bit about the Leukemia Lymphoma Society, but mostly there's going to be one slide that will provide for you resources that will be very helpful in your journey. And I think that's very important. I hope you walk away with some information. If you don't feel you got enough, we're outside here. I'm here in the afternoon as well as at lunch. I'm happy to answer your questions. So here we are with our mission statement. Basically, it's really two things. One, cure this thing, and number two, improve the lives of patients and family members and caregivers. So this is what we try to do. A lot of people know about the first one, but we have research dollars. That said, it's really, really important to us to help the patients as well. So I think that we're kind of special. In the sense, I have a lot of school spirit around the Leukemia Lymphoma Society. First of all, I have a family member who had a blood cancer. That said, we really provide services and invest in research. It's really, really very important. So the first item there is LLS funds research to advance more promising therapies for blood cancer patients. Wow, I can tell you that since we've started, we've invested over $1 billion into research. Last year, we did $78 million. Of that, $10 million is here at UCSD in current projects. And historically, we've given them $20 million over the years. And I give you those numbers because here you are in this amazing place, getting amazing information. And I'm just so glad that the work they're doing here helps you down the road and now. So, the second one here is what we hope to be the voice for all blood cancer patients. We've done great things, but despite all the things that we do, there are folks still dying, and so we're going to keep working on that. Your rates are a little bit better. And I just put this slide in here. I'm going to get off this slide and just really quickly. I just wanted to show you that how much progress we've made. And in CLL as well, I give the example often of ALL, because in the 1960s and early 70s, ALL patients, children, survived 10% of them. Today, 90% of them. So it's always a great statistic to share. So we do a few things. We have patient services, which I'm going to focus on, all the resources that we have, but we also provide education programs, and we do that for lots of things, CLL, also other disease-specific programs, but also health literacy programs. Actually, one of your doctors here at UCSD helped us out in October with an event, How to Communicate with Your Doctor in Spanish, to help that community. We also do legislative advocacy. I'm going to skip over that, but I'm happy to answer questions there too. So here's the list. I think that the first one is really important. We have free education materials, booklets, and fact sheets. You can call me and I have them. You can call the Information Resource Center, and I'm going to speak about that and get some. You can go on our website. There's some amazing information. I will point out that all the information is current. So when we get a new brochure, and we got one for CLL this year, and if you look on the back, the information came out in 2014. So we really, really work hard to get you the most current information. Now for us, I heard the previous speaker talk about different considerations and problems that people are facing. For us at the Leukemia Lymphoma Society, obviously the first one is the illness itself, but the second one is finances. There are folks who are really, really struggling to make... Oh, yeah. Oh, okay. Well, I don't... what do you want me to repeat? So we were at Financial Matters. So like I mentioned, this for us is the second most important thing. Folks call us up. They say, oh, I want information about CLL or ALL or whatever blood cancer it is. And then we hear right away, I can't pay for this. I can't get to my appointments. I don't know what I'm going to do. So we have something called the Copay Assistance Program. We do have funding for CLL, which is great. This program is to help you pay for your co-pays, but also your medical premiums. So at the end, I will have the number up as well. If you call the IRC, you can get more information about the co-pay assistance program. One of the great things about that program, it's really not just for, impoverished folks and indigent. It's for everybody, a lot of people. If you are at 500% or below the federal poverty line, you're good to go. If you're a citizen, you're covered with the illness and you can prove that you have it, you're good to go. The third item here is one of our favorite things to share with you. We have a program called the First Connection program, and it's a peer-to-peer support program where folks who have been recently diagnosed, we connect them with the folks that have gone through their cancer journey, who've received also training from the Leukemia and Lymphoma Society, so that they can talk to folks that have been recently diagnosed. It's a great program. We try to connect folks based on sex, age, obviously disease, and hopefully treatment modality as well. So, and we do this all around the country. So if we can't find it, we'll find somebody you can talk to when the illnesses are very rare. The next one is support groups. We have them here locally. We have one support group that's for all blood cancers. It meets once a month, and we do have a flyer outside for that. If you go online, you can find out more information about our programs. Sometimes there are programs that we can't offer here locally, but we can via the internet nationally. So if you go online, then you can find out what's coming, but you can also find out what happened. So maybe you'll look and you'll say, wow, a CLL thing came and I missed it. Nonetheless, you can go back and listen to it. In fact, there are transcripts of those as well, so something else you can go and look at. We have the education videos, online chats. We also have online chats, support groups, and discussion boards. So there are people who not really feeling wanting to go to a support group. Some people live far away and can't come to the support group. Another way to access services is through that manner. We have our local chapter, which does cover Hawaii. So cool, right? And the clinical trials I'd like to put a little emphasis on. We have a great tool, and it's right there, a trial check. You can go there and find out which trials could be good for you. Now that's sometimes not enough. So you can also call our 1-800 number and ask as well. We actually have one person that's dedicated only to finding clinical trials for blood cancer patients. So if you can't find something, you can speak with her and see if you can find something. Hopefully you can. So this is what the IRC, the Information Resource Center. We want people to know about this. Some of the things that I talked about, you can get that information there. This group of people who are running the phone lines are amazing. They are oncology nurses, they're licensed social workers, they're health educators, and they certainly know more than I do about disease. So if you have a question about CLL that's specific to the disease, they'll probably know the answer to it, or they'll find a way to get that answer. So I have brochures here. I see a couple people writing. We have that information outside. We're doing questions later. And I'm finishing up. I just really appreciate the opportunity to be here. And again, thank you to all the folks that are working here at UCSD. And if you have questions, just let me know. And near the end, I can also address your questions. Okay, thank you.